now move on to our 10th session, and that is the gastrointestinal care part 2. In this session, topics to be discussed are paracentesis abdominis, laparotomy care, and Heimlich's maneuver. Laparotomy care was done under surgery in pre- and post-op management of patients, and Heimlich's maneuver was also treated in cardiopulmonary resuscitation or basic life and advanced life support. So we shall concentrate on topic 1, and that is abdominal paracentesis. The first topic is abdominal paracentesis, which is also known as tap or tapping. And abdominal paracentesis is a technique used to drain an abnormal collection of ascitic fluid from the abdomen, or it is the removal of fluid from the peritoneal cavity. Ascites is the abnormal accumulation of serous fluid within the peritoneal cavity. And normally for malignant ascites, abdominal paracentesis gives good and temporary relief from distressing symptoms in approximately 90% of cases, but it does not cure the patient of the cancer. It involves the introduction of a needle into the abdomen to remove excess fluid, and is indicated, or the purposes include to relieve pressure symptoms associated with ascites, to make diagnosis in order to obtain specimen for chemical and bacteriological as well as cellular composition of the peritoneal fluid for various diagnoses of certain diseases, for drainage of exudates in peritonitis. It's also done to give treatment as in pulmonary tuberculosis. Treatment is given and installation of medication through the base of the lung is done. It's also done in cirrhosis of the liver, patients with chronic pericarditis, advanced congestive cardiac failure, malignant conditions as already stated as in metastasis of cancer of ovary, stomach or colon where tumor extends into the peritoneum. It may also be done for diuretic purposes and installation of peritoneal agents as in installation of cytotoxic medications. It is, however, contraindicated in absolute in anticoagulation, severe patients with coagulopathies or problems with blood clotting, severe and irreversible disorders of coagulation. Relative indications are poor patient cooperation, surgical scarring over the puncture area, severe portal hypertension with abdominal collateral circulation. And then patients who appear to be very frail or unwell, it is necessary to ensure that they are hemodynamically stable and include the lying and standing blood pressure. Now, the sites for paracentesis abdominis include midway between the symphysis pubis and the umbilicus in the midline, or a point 2/3 along a line from the umbilicus to the anterior superior iliac spine can also be used. We have the requirements. We need a trolley, or we have our paracentesis sets, which include forceps, scalpel blade, dressing towels, suturing equipment, trocar and cannula. We have a dressing pack, sterile receiver, specimen bottle, sterile gloves. Then we may need clamps, a local anesthetic agent, antiseptic cleansing lotion, adhesive plaster, weighing scale if necessary, tape measure, Macintosh and towel, resuscitation tray. So now the responsibilities of the nurse. The nurse explains the procedure, and then privacy is provided. The nurse also ensures that the trolley for the procedure is set. Patient is asked to void or empty the bladder before the procedure. Patient is weighed before the procedure, and then the abdominal girth is also measured around the umbilicus before and after the procedure and recorded. Then the vital signs are also monitored. We need the baseline data to compare, so that we compare and see if patient is entering into a state of shock. Patient's hygiene needs is also seen to, or patient takes his or her bath. If patient is hairy, the area may be shaved. Then the patient is placed in the semi-recumbent position, and the bed clothes are protected and also folded back. Patient signs informed consent, and we also weigh patients. Then for the position, patient can be seated either on the side of the bed or in a chair with the feet supported. Now the procedure. The procedure is mostly performed by a doctor, and the nurse assists the doctor. The responsibility of the nurse during the procedure is to position patients and then support and assist the doctor by supplying the necessary equipment or requirements for the procedure. So a local anesthetic agent is given by the doctor, and then incision is made. Trocar and cannula is then inserted through the incision. The trocar is removed, leaving the cannula connected with a tubing, which is in turn connected to a drainage bag. Then if the cannula is to remain in position, it's normally held in place by sutures. Then we have the closed drainage system attached, as already stated, and a supportive dried pressure dressing is applied evenly after the procedure. Then after the procedure, patient is made comfortable. Then the equipment are discarded, and patient's vital signs, the weight and the abdominal girth, are all taken or measured and recorded again and compared to the baseline. Patient is again observed for signs and symptoms of shock, and then the drainage is also examined or observed for color, amount, and then the consistency. Patient is kept warm to prevent shock. The hands are washed, and sometimes renal function is also checked after the procedure as ordered by the doctor. But remember that we ensure privacy throughout the procedure. And remember to wash your hands before, during, and after the procedure. So we come to the end of our procedure, that is Paracentesis Abdominis. For our reading list or reference, please, you are being referred to read Smelter, Bear, Henkel, and Shiva in Brunner and Sadan's textbook of medical surgical nursing.